Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. I have been doing episodes on the main topics that I teach in pharmacy school on pharmacy informatics. What I also wanted to do was discuss some journal articles and basically start a journal club. Now, this is not going to be an in-depth journal club as you might do on your API rotations where you're reviewing a randomized controlled trial and getting into analyses and methodology and findings and discussion, statistics. I'm probably not going to go into that much depth, partly because a lot of the articles that have been written on pharmacy informatics really aren't in-depth research articles. They're more primers, editorials, or notes or case studies, really. So, but I do want to just point out along the continuum, going back to the start of when we started seeing articles on pharmacy informatics, maybe 15 years ago, and then up to today, some of the articles that have been written, some of the earlier landmark articles, and then others along the way that might be interesting and might emphasize some of the topics that we talked about, give you a better idea of what's going on in the real world in terms of these medication use technologies. So let me start with talking about some of the articles that I have talked about before, actually, and share with you a new one also. So let's get this presentation started. So when I was talking about pharmacy informatics and the teaching of pharmacy informatics in pharmacy school, I referenced a number of articles that came from the American Journal of Pharmaceutical Education, AJPE, and those were surveys that were done for finding out how we're teaching or the level of pharmacy informatics being taught in different pharmacy schools. And then as we discuss some other topics such as programming, I did talk a little bit about some of the articles that I have written. So I'll do that. I'll start with articles that I've written over the years. And this was one that I talked about that I did during my residency. This is a residency project, and this was a programming project that had to do with enhancing our electronic health record at my site to allow nursing to order missing doses and refills. And then I also talked about a project that I had done where we wrote a program on the intranet of our system. So a web program, an app that allowed the pharmacists to document their interventions. I also talked about databases and how to build databases, and mentioned a lot of details about building properly and testing your drug database before you go live. So we've been over this one, and then this article was on decision support rules and really the process around identifying rules that need to be written and then ranking those and then doing the work to build, test, implement those rules, and then, of course, sunset them or turn them off when they're no longer needed. And then today, I wanted to talk a little bit more about another article which I don't believe I've covered before. And this was another project, a little bit dated, because this was at a time when we were completely on paper, and the physicians were not yet on CPOE, so the providers were not using CPOE for ordering medications in the hospital. We still had paper orders, and so what we had to do in the old days was either pick those orders up from the nursing floor, or they were faxed to pharmacy, and then we would enter those into our electronic health record manually. So we came up with a solution to that so that we could transfer those documents digitally. And there was an application out there at the time that did this, but it was difficult to implement because it was, number one, expensive, and number two, it required that you put a scanner on every nursing station. And this was a problem because real estate, desktops, real estate at the nursing station is very limited, very crowded. And so what we wanted to do was use existing machines, existing technologies, but get a digital image of those orders. So we used our current fax machines that we had, and instead of a fax being printed out in pharmacy, we captured that fax electronically and then used another piece of software to manage that basically in a image database. And so what we did was eliminated that paper shuffle, the transferring and printing of orders or having to pick them up from the floor. And that was very effective at the time. Now, once we went to computerized provider order entry, it eliminated a lot of that paper shuffle because we no longer had our providers writing manual orders or paper orders. So let me just say that you will never be 100% paperless. So there's always going to be some paper documents that need to be scanned into your EHR. So this type of technology is still valid. And even though it might not be used for 90% of the orders that are out there, there might still be that 3 to 5% of orders or documents for your patients that come into the hospital that you need to get digitally into your electronic health record. And so this article kind of reviews that whole process, how we went about it, and again, still valid in this day and age where the goal is to be 100% paperless, get rid of all the paper. But as we know, that's not totally practical. There will be situations where things are still documented on paper, but we do want to have a complete electronic health record with that documentation. And so these are situations where we want to get a digital image of those and scan them into our EHR so that those documents are available for all of our users, our healthcare professionals to see when they're taking care of the patient. And with that, if you found this helpful, please like this video and subscribe to my channel. And I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue working on new episodes and hope to see you next time. Take care.